This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Mike Murphy.
Thank you, Charlie. Yes, I am Mike Murphy, host of the Good Neighbor Podcast. We're a podcast here in Northern Kentucky. We talk to business owners, we talk to movers and shakers, we talk to nonprofits, we talk to human beings who I think you need to meet. One of those human beings is sitting right next to me today. It's always nice to be face to face, shoulder to shoulder with people in the community. And the person I'm with today is Dr. Kelly Gersch. She is, what is your title here at Mission? Let's start there.
Medical lead is my title here.
Okay, at Mission Veterinary
Medical Center. You got it. Yeah, it's a lot of words.
Yeah, it is. I have it written down in front of me just to make sure it's keeping me honest. But today we want to learn all about Mission Veterinarian Medical Center. You're the person that's going to educate us today.
Yeah.
We're going to learn about you personally. We're going to learn about the practice here. And we're going to talk about some of the people here that kind of help you do what you do. So let's get to it. Welcome to the Good Neighbor Podcast, Kelly. I want to just say that the few days that I've gotten to know you and the staff here, it's been a pleasure because everybody here is so friendly and welcoming and just warm and fun to be around. So hopefully that will come through in the podcast today. So Dr. Gersch, please tell us, who are you and how did you end up at Mission Veterinary Medical Center?
Thank you. Thank you for having me. We're excited to be a part of the community. That's certainly the case. I am a veterinarian. I grew up in the east side of Cincinnati. Okay. I went to the now defunct Glen Estee High School a very long time ago. I graduated from there. And after going to vet school at Auburn, came back to the area with my husband. We have lived in Northern Kentucky since 2016 when we came home. Home to me. He's from Detroit area.
Okay.
And now we live in the Taylor Mill area with our 3 dogs and 3 cats, a very, very full household.
Sounds
and
like it.
Wow. And this is my second startup hospital in the greater Cincinnati area. Mm-hmm. In 2022, I partnered with another veterinarian who is still at Mission Vet Urgent Care in the Blue Ash area. Okay. And then just September 15th of 2025, we opened here in our Florence, very close to Union office. So we are excited to be in the Northern Kentucky community, offering both general practice and urgent care. And I'm excited to be back in Northern Kentucky practicing. It's been about 6 years since I've been down here, so okay. I'm happy.
And went to school at Auburn, huh?
Yes, War Eagle.
Okay. It's a beautiful campus, I hear.
It is lovely, the loveliest village on the plains, if you haven't heard that phrase before.
I'm more of a Michigan guy, like your husband. He's from the Detroit area, and I'm.
He is a staunch SEC convert at this point in his life.
Okay. I'm Go Blue. I'm Michigan. I'm a Wolverine, tried and true, through and through. So Go Blue. All right. So I've walked through the facility here. This is it's modern, it's clean. You've got a lot going on here. We're going to talk about some of that. You told me you were in surgery this morning. Mm-hmm. So that brings me to the question, like, what type of services do you provide here for the local community and their pets?
So we do full general practice. So vaccines, sick appointments, anything that you would run of the mill see any veterinarian for on a regular basis. We can provide those services. So surgically, spays, neuters. Right now, we're actually working with Pendleton County Animal Hospital. They don't have a full-time veterinarian there. Mm-hmm. So Dr. Metka and I are associated, my other veterinarian here. Okay. We're providing those spays and neuter procedures so they can adopt out as many dogs already altered and rabies vaccinated and up to date on everything as they possibly can. We also offer urgent care services. So what our goal is eventually to mirror the hours at our partner hospital in Blue Ash, mm-hmm. where they traditionally do after hours care. Right now, Dr. Metka and I are doing 9 a.m. to 6 p.m. on Saturdays. Okay. So we see patients from any local hospital or anyone who doesn't have a veterinarian. If you have an issue that you need urgent care for, so that ear infection that just came up, your dog's vomiting or maybe having some diarrhea today and you need to get seen today, but it's not a medical emergency. So that's kind of that in-between place. Just like you think about urgent care for people. I
Right.
always use the analogy, you go to urgent care when you have the flu, not when you're having a heart attack. Same thing goes for pets. So you come and see us when you've got something relatively minor but needs care. Maybe your pet's uncomfortable for some reason. But, if you have a pet that's having trouble breathing or has been hit by a car, fell from a high place, those we still are going to refer you to one of our emergency partners in the city.
Okay, so that's a good point because, I was thinking back to, I was in my 20s, me and my wife, we had a little cat, and it showed up at our door one day after being outside, and something had just tore it to shreds.
Yeah.
And so in that moment, of course, it's always like on a Saturday night or a Sunday night,
Always.
you're panicked, you don't know what to do. So if you can't handle those emergency type of things, people can call the office and be directed towards who they can go to for those emergencies.
They give us a call. You can also just come in. If you're not sure where you need to be, you are always welcome to come in our door.
Okay.
We are right on 42 across from the old Kroger where they're putting the Boone County Educational New Services Center in. That what we'll do, let's just say your kitty that got torn up. If that was beyond what we could service here, surgically repair, then what we would do is make sure pain medication, make sure your pet was stable, and then make a direct referral to an emergency facility. So hopefully you don't have to wait as long there, and also your pet's comfortable, and you have an idea of what to expect when you get there.
Okay, so we're sitting in Union, Florence area right now. What is the closest true pet emergency center?
The closest center that is 24 hours a day, 365 days a year is MedVet of Cincinnati on Red Bank Road.
Okay.
Greater Cincinnati Veterinary Services over in Wilder, they do emergency care. They are not 24/7 from the best of my understanding at this point, but they're getting closer to doing that again. And there are three other ER facilities, one on Winton Road, Grady Veterinary Hospital. There's Care Center up in Sharonville. And then there's a newer one, Veterinary Emergency Group on Madison Road in Oakley.
Okay.
I think the thing that makes us a little different is that Dr. Mecca and I have worked in urgent care. I also had the opportunity to work at MedVet in the emergency room on short-term basis when I was in between hospitals. And so we have great relationships with the ER providers and can make sure you're going to the hospital that has the services and the practitioners that your pet needs. So we can send you to see a neurologist if you need that versus a hospital that maybe doesn't have that available.
Because at the end of the day, you're charged with caring for the pets in the community. And so therefore, I think all of you docs, you're circling your wagons around the local pets.
Yeah.
And you're working in harmony to just take care of all the furry loved ones. Usually it's cat or dog.
Yeah.
And so that's just good to know that you guys can all kind of join forces for the common good of all those little fur babies we love.
The veterinary community in Cincinnati is a relatively small one. There's not a ton of us, and we all know each other. And so it's always really great when we get to make referrals. And, I'm a huge fan of your veterinarian. The relationship with your veterinarian should be one where you feel comfortable, you feel heard, you feel like your pet is happy and healthy and thriving because of the veterinary relationship that you have. And so I'm a bubbly kind of outgoing person in the exam room. Yeah. Not everyone is, my cup of tea. Dr. Mecca, as I tell people, she's very thorough. She's very direct. She's very wonderful. She's probably not as wild as I am sometimes. So we complement each other. But, there's a lot of veterinarians in our area for a reason. Everybody should find the one they feel most comfortable with. For the most part, though, I guess out of this office and just about any veterinarian office, you're dealing mostly with well pet care. Is that correct? Just keep making sure that the pets are on schedule with vaccinations and that they're growing properly, that they're thriving, that everything is working well. That's my perspective. Is that true? Or I think that, we see in veterinary medicine that we get pets during every point in their life. And if you are a new pet parent to a puppy or a kitten, that's absolutely what we do. Our goal and my job is to talk to you about, here are all the things that we can do to set them up for success. Here's what preventative care at a optimal time frame looks like. And then also we talk a lot about lifestyle. So what are you going to do with your dog? Maybe your dog is going to go hiking with you and you're going to take your dog to, I don't know, Isle Royale National Park in northern Michigan.
Yeah.
And
Beautiful place, by the way.
It is. It is. Also, very heavy tick burden. So we
Ooh.
would want to make sure that your dog is protected against Lyme disease.
Okay.
And maybe we do a little extra tick prevention in addition to your monthly tablet. Same thing with cats. Like, are you going to have an adventure cat? This is something I've recently learned about. Adventure cats exist. People have their cats trained on harnesses, and they take them all over the country. I'm completely enthralled with this idea. Recently, I have a 2-year-old cat who I think he wants to be an adventure cat in his another life. So that's a cat that we would make sure that he has prevention for fleas and ticks, where maybe we don't think about that as much in our indoor kitties. But as pets age, I think a lot of what we're seeing, we have really amazing data to say that pets are living longer than they ever have.
Okay.
So while you'll see some contradictory information out there that says, well, cancer rates are higher. Well, I just met a 24-year-old dog about a month ago.
Wow.
And so, when pets live longer, higher rates of cancer do happen. Same thing happened in people once our life expectancies went from the 50s to now in the 70s. Right. Mm-hmm. And so a lot of what we do as pets get older is in preventative medicine is less focused on, hopefully your 24-year-old dog is able to go adventuring with you. But if they aren't, like my 15-year-old dog isn't, what we focus on for her is she comfortable? What can we do at home? What nutritionally can we do? What does she need in terms of making sure that her chronic conditions are managed? She has kidney disease. So it's a whole body experience for her to make sure that we are keeping her comfortable in her osteoarthritis, keeping her kidneys happy, keeping her dental health up to snuff, because that impacts all the other organs in our body. So what I love, if you can't tell, I adore geriatric patient care, and kind of making those guys age as gracefully and as flawlessly as we can. Mm-hmm. That is one of my favorite things to partner with families about. Maybe it's something as silly as just buying a dollar store runner for where they come at the bottom of the steps, but sometimes that can make a huge difference in how comfortable they are going up and down stairs. Okay. All those kinds of things, getting a different water bowl because it's higher now and they don't have to bend down as far. I think that is one of the most rewarding parts of my job.
That's a good point, because, like we've got a very young puppy right now. And when you bring a puppy into the house and you kind of get that routine going, you understand, all right, this is how we do things now. Yeah. You're trained to do this, 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 and this, and we interact with each other. But as they age, I can see how you might fall into keep those same habits, but you need to change things up based on aging pet. Right. Like you said, like stairs going up to the bed or runner, all the different things. Yeah. We don't always think of those things, but you can help us do that.
Absolutely. That is one of my favorite things to do. I will talk about during your, pet's annual, or we like to see senior pets in twice a year just for those reasons. Okay. So we can have that conversation of elderly cats. Are they hesitating before they jump up onto the counter where normally it was just this graceful leap? That hesitation is a sign of pain in cats. And the cats aren't going to meow. They're not going to miss jumps because they're way too proud to let anybody see them fall. But they'll hesitate at the bottom, look at it, think, all right, I can do this. And then they'll make that jump. Yeah. Those are the kind of things where we say, all right, where does she like to spend her time or he like to spend his time? Let's get him some stairs up to that area. Let's see if there is do we need to offer him medication or some kind of supplementation in omega-3 fatty acids to help his joints be more comfortable as he ages? We have had such a tremendous 20 years ago, my first job as a veterinary assistant was in a rural veterinary hospital in Bethel, Ohio. And I can absolutely, without a doubt, tell you that we are 100% improved how we handle pets and the medical care we can provide to them. Okay. And that being able to specifically to do that in pets as they age, we just have so much available to us. And if one medicine doesn't work, there's probably 5 others that we could try, or we could try something that's non-medical. My pets get acupuncture for their osteoarthritis and back disease. Okay. Our 3 elderly dogs do, and tremendous change in their life. So
you're like a super mom.
I'm very blessed that I have 4-legged children. My husband and I did not have 2-legged children. We weren't successful in that endeavor, but I will say, yes, they do get, I think, a lot of extra attention because of that.
Yeah. Cause you're the first person I've met who does acupuncture for their their pets. So
Yeah, I would have told you a year ago that I was very skeptical about it, and now I'm a complete convert.
Okay, that's an interesting point. We'll have to discuss that more some other time. I'd like to know more about that.
Yeah, happy to.
Okay, so I'm still mentally stuck on this whole adventure cat thing because I'm picturing a cat jumping, bungee jumping off of a bridge, and it's like that's a mind blowing thing for me. But
I'm
thanks.
getting into it. I mean, the bungee jumping off a bridge. People are taking. Like, I saw a cat. I was at Joshua Tree National Park about 2 weeks ago with my husband. There was a cat there. He was trucking up the rocks, having a grand old time. And they told me about this Facebook group, Adventure Cats, and that's how I learned about it. Now I am too, like, very, very intrigued by it. Checking that Facebook group out all the time.
Interesting. So speaking of your husband, what's his name? How long have you been together? And I kind of get the impression that you guys travel and you like to have fun together. So let's talk about that a little bit. When you're not busy in surgery or caring for our pets, what do you do for fun?
Yeah, my husband, Matt, he's a civil engineer. He has worked here in the Cincinnati area for 20 something years now.
Okay.
We got married in 2013, and he has been my constant supporter. He is one of the kindest, most humble people you'll ever meet. I tell people all the time, he makes me a better person, just knowing him. I'm very, very happy and grateful to know him and love him. He has constantly been a supporter of this. So we used to have houses. We have some rental property. So we used to do that at night, work on houses. We did that in Dayton, Bellevue, and Newport, Kentucky. And now for fun, we spend a lot of time taking care of the old lady dogs. I will not lie about that. We love to travel, try out new restaurants in the area. And the thing that I think that we spend the most time doing is trying to figure out what our next adventure is going to be. I could never have opened 2 veterinary hospitals without his support. He's the guy who will come here, and he hung up all the pictures in all the exam rooms if you come in, because he's got that very structural eye. So he's that kind of a dude. He shows up however we need him.
Well, good. And you've got the dog and the cats at home. Now, you want to shout them out, even though they probably won't be listening to this podcast?
They won't, but I will tell everyone
show them
about
some love.
the 6,
Show them
the
some
6
love.
of them. So we have 3 elderly dogs, Ruby, Nora, and Marley. And then the wild cats, Al, Gersch, he goes by his formal name. Edie and Amos is the little wild child.
Okay. Well, I think, you've got a heart for your little pets at home, and that just kind of, I'm sure, carries through to the animals that you see here in the clinic. Yeah,
it's a privilege to be able to care for pets and their people. One of the greatest things that I love about my job is to be able to help people making those decisions when things are tough and it's hard to know what the right answer is. I also just will never see more joy in the world than a first puppy visit. The proud new parents coming in with, they're like, look at this little baby. And they are the cutest things in the world. I love that people bring me their puppies. I get to play with them and then send them home and they get to potty train them. It is one of my great joys.
Well, I have to say, with our new puppy, every milestone and, as the puppy learns, you do feel pride. You're like, wow. I mean, they're smart. We're smart. It's like, let's just celebrate the fact that we're making this work, because those first few days you're like, what the heck have I done here? It's like
puppies are toddlers, but they're more destructive usually. They have sharper teeth. That's for sure. Everybody should be accomplished. If you potty train a dog successfully, you've done a big thing.
Yeah. He tells us right now whenever he needs to go out, he makes it known. There's no more potty accidents. So, yeah, and you'll meet him soon.
I love it. What kind of dog is he?
A little mini Aussie Doodle.
Oh, I saw his picture. He's adorable.
Yeah, he looks like a little teddy bear.
He did. He was a very fluffy little baby.
Yeah. So he's a fun guy to have around. So, do you have a particular case that comes to mind throughout your history that is maybe one that's closest to your heart, that maybe was heartbreaking or heartwarming? Something that has really stuck with you through the years?
So this is my 10th year as a veterinarian. So there are many of them. One of them that I love to manage diabetic patients. It's a weird thing.
Okay.
My husband is diabetic, I think, so it is near to my heart.
Okay.
But also the dedication that owners of diabetic pets have is second to none. It is a very hard disease to manage from an owner's perspective, and it's hard on the pets. And as a veterinarian, it can be very challenging to get right. But I love the bonds that we forge. There's a very elderly dog. He is no longer with us. I met him as a third opinion on managing his diabetes early in my career. And he was about 150-pound yellow lab and was very difficult to manage. His parents were kind of frustrated with how much, diabetic dogs pee a lot. When your 150-pound dog is peeing 6 times a day in the house, that was a lot for them to handle.
Right.
And they were kind of at the end of the rope. We had a very, very, very positive and forthright conversation. And we ended up managing him successfully for another, I believe, 3.5 years. And I think he was 9.5 when I met him. And he went on to have cataract surgery. And after that, he just became a puppy again. And it's one of those things that it was what turned me to say, these families need a champion to remind them of, hey, this sucks and you're doing a really good job. And that I think was the case that really just made me realize that might be my little niche in the world, is to support these families in a way that they haven't felt supported before.
Gave everyone a new lease on life.
Yeah. For sure, the big guy got a new lease on life. His name was Leroy, and he was adorable.
Okay. Well, shout out to Leroy. So you've got a wonderful staff here. Let's talk a little bit about who's here. When somebody walks in the door, who are they likely to meet?
Most of the time, they're going to meet Angie.
Okay.
Angie is she is a recent transplant from Colorado, and she is back in this area from I'm going to just call her out on here. She's dating now a man who she knew in high school.
Okay.
And they're rekindling their high school romance. I think it's the sweetest thing on the face of the earth, and they are wonderfully happy. Angie is a ray of sunshine, and you'll probably see her with some sunflower gear on.
Okay.
You may also meet Carissa or Megan. There are 2 veterinary assistants. Both of them have worked in veterinary hospitals before and have this very comforting, calming light about both of them. They're a joy to have around. Let's see, who else do we have? We have our 2 more senior technical staff. So we have a registered veterinary technician, Taylor Roseberry, and Liz. She is Liz Johnson. She is our more tenured veterinary assistant.
Okay.
Both of them have been doing their jobs a very long time. I tell people all the time, you want them placing your pet's IV catheters and drawing your blood, not me. I'm always in awe of how skilled they are and how comfortable they keep our pets.
It takes a village.
It does. We also have, you very well might also see Jordan Hayden. She's our practice manager. She is truly the one that runs everything around here. I tell people all the time, do not set up an appointment with me. Make sure Jordan does it, because she will tell me where to be. And that's really what I'm good for, is seeing patients, being a doctor, and being where Jordan tells me to be.
Yeah. Jordan's a wonderful person, ray of sunshine. And
Yes.
I'm not just saying that because she's standing or sitting right over there.
Yeah.
It's because I really feel that way.
It's true. She is. And then the last person here is Dr. Libby Mecca. She is our other veterinarian. Taylor, our technician, Dr. Mecca and I have been, I've had the great privilege of working with them now. I realized actually just this morning, we are approaching our 6th year of working together.
Wow.
They have been consummate supporters of mine, and they've followed me now to the 3rd clinic. And I'm going to probably get a little misty-eyed. I can't be grateful enough. Libby is one of those people that I can leave my patients in her hands and know absolutely that they are getting the very best care. She is an exceptional surgeon and wonderful veterinarian. And Taylor keeps us both on our toes and organized. Those fine ladies drove an hour out of their way to come work with us at Urgent Care, and now they're back home. And I just can't be more grateful to have them.
So we talked about your husband. We talked about your pets, but Dr. Metka's the one that makes you cry. Interesting.
I will say you spend a lot of time at work, and
Yeah.
Dr. Mecca is one of those people that we kind of grew up as doctors together. So
Okay,
it's
good.
been
Yeah,
it's been a fun time.
Yeah, you've been through it together.
We
Yeah.
have.
Okay, good. So how long have you actually been in this location here, open for business, here on 42?
We have been open. We opened September 15th, so just a
Okay.
little under 5 months.
Okay. So if you're putting a call out to the community, what do you know, if you were standing on a stage with a microphone and the entire community is out there in the audience, what would you say to them? What do you want them to know about the practice here?
Yeah, we are here for you and your pets. Our goal is that your pets come in and experience the least stressful, happiest veterinary visit they've ever had.
Okay.
We are offering new patient first exam fees at
Okay.
no charge. So if you just want to come in and have a second opinion, give us a tryout, come and meet us. We will do a physical exam on your pet at no charge to you. We'll be happy to review their records, make sure they're up to date on vaccines, or if your pet's sick, you just want to talk about it, come by.
So the first exam is always free. Is that an ongoing thing, or is that a limited time only, or what?
We are doing that until Dr. Mecca and I can't keep up anymore.
Okay.
So yeah, it'll be
Right.
for a while, we hope.
Okay. You just want to meet new patients and the community, and okay.
We want to give people an opportunity to try us out, and there's no risk involved. So if you are, potentially flirting with the idea of finding a different veterinary clinic, we're here to let you give us a try.
So as we sit here having this discussion, it is February. What is special about February?
February is Pet Dental Health Month. Dr. Mecca loves surgery. I love dentistry. So it is one of my favorite months of the year. Every veterinary dental procedure, teeth cleaning effectively, that we do, we're offering families $100 off of those procedures. We know that those can be costly at times, especially if you've got a adorable little dog. Maybe they have some genetically predisposed dental disease, and those kind of doing those procedures can be expensive. So we're going to make it more affordable for everybody if we can.
So if somebody out there has a diabetic adventure cat with bad teeth,
I'm your girl.
You're the person.
I'm your girl. Yeah.
All right. Awesome. Good to know. So off the top of your head, do you know what your address is here?
Yeah, it is 8780 US 42, suite number A. We are in the same building as Christ Hospital Physician's Office.
Okay. Kind of across the street from the old Kroger. Okay, that's one way of thinking about it. So phone number is what?
859-201-2432. You can also book visits online at our website, missionvetmedicalcenter.com. You can book them 24 hours a day. It's open. You can pick whether you'd like to see Dr. Mecca or I. And the visits that we have available are constantly updated. Our hours are 8 to 6, Monday through Friday. So we're open for visits then, and 9 a.m. to 6 p.m. on Saturdays. We are closed on Sundays right now.
Okay. Well, you got to rest sometime, right?
I do. I got to get home to those dogs.
Yeah, they need their mommy. Okay. Well, that just about wraps up everything that I wanted to cover with you. Is there anything we haven't talked about that you want people to know?
Thank you for welcoming us so warmly to the community. We had a wonderful turnout for our ribbon cutting in October, and we're just really grateful to be here.
And you guys are going to be part of a Pure Bar puppy yoga thing?
Yeah, thank you. Yes, Saturday. I think, Jordan, do we have any spots left? We have 2 spots left. If
They'll be gone by
listening to
then,
that.
but
but puppy bar. So every quarter we're going to have a different workout class with puppies here. So keep a look on our Facebook page.
Yeah, because by the time somebody hears this, sees this, whatever, that event will probably have passed, but there's going to be more in the future.
Yes.
Okay.
Every quarter, keep a lookout.
Kind of like goat yoga, but with puppies.
Exactly. And we'll try to, I think yoga is coming. We partnered with the Pure Bar group. If you've got an idea, let Jordan know. She'll probably find somebody to do it.
Okay. Shout out to Pure Bar. They're a great community partner.
They are. Yes. I got to listen to her. Your conversation with her
Jennifer,
last week.
Yeah. Okay. Well, I think that just about does it. I mean,
Wonderful.
that was a nice conversation. Took about a half an hour. And I appreciate you spending some of your valuable time with me and with the community, just letting people get to know you and a little bit more about Mission Veterinarian Medical Center.
You got it. Thank you for having me. I appreciate it.
Well, thank you. And everybody out there, thanks for spending time with us. We are the Good Neighbor Podcast. So before we sign off, we always let everybody out there know, please be good to your neighbor. Till next time, everybody. So long. Bye-bye.
Thanks for listening to the Good Neighbor Podcast Union. To nominate your favorite local businesses to be featured on the show, go to gnpunion.com. That's gnpunion.com, or call us at 859-651-8330.